And at the time, the whole unit was bio. So it was nothing but COVID patients. They were all intubated, sedated, and prone. And he said to me, Elizabeth, it's really terrible. I don't know anything about these people. I could be dealing with body 1, body 2, body 3, doing nothing but adjust vent settings and pressors and so forth. And it came to me just instantly in response to Brian. And I said, you know, Brian, I think I can help with this. How about if I reach out to the loved one, to the person identified in Epic as the point of contact? And as you're aware, there were no visitors in the hospital at all. And ask them, who is this person? Tell me about this person. Do they like Chinese food? Do they wear their Nikes without socks? Do you guys have a dog? Right. And so Brian and I got all the appropriate permissions and all that, and I started to do that. And so I developed this program, TIMS. This is my story. And because I'm accustomed to producing things that are very short, I could conduct this interview with the loved one and render it to a file that was 2 minutes or less. We put that into the chart and then gave it to the entire medical team. So on the MICU, they all round in like knots, if you will, with computers that are on their little trolleys, and they stand outside the room, and they would stand in these groups and play the file. And then they would all know something about who is this person. And let's hear in their voice to their loved one why this person is so important.
Patients have been struggling to get their voices heard in hospitals and medical teams for 100 years. And you know, the famous Francis Peabody essay, the secret of caring, the care of the patient is caring for the patient. So you came up with a way not just to do it, but to integrate it into the electronic health record, to present it on equal footing with all the other data they were looking at in the electronic health record, and access it at the time that they're accessing all the other data in the electronic health record to take care of the patient. That's extraordinary.